Joining us for our Your Health segment tonight is University of Maryland St. Joseph Medical Center breast surgeon, Dr. Ethan Rogers. Doctor, thank you for being with us.
My pleasure.
So what has been so effective over the years, over the decades, in reducing the mortality rate from breast cancer?
I think in one word, mammograms. And that's very clear that when routine screening mammography started and was adapted as standard practice, that the detection rate increased because you were identifying things at an earlier stage. And obviously, if you find things at an earlier stage, you're more likely to treat it when it's not a problem versus when a patient can feel something. And then it more than likely is going to have a worse outcome than when it's found on mammogram. I think the other thing that has definitely decreased the mortality rate is the improvement in the drugs that we have to treat breast cancer. Breast cancer is a very well-funded research subject, and new drugs are coming out almost every year to treat breast cancer. That's why I tell patients when they're coming through that even if the worst case scenario happens down the road, there are always new drugs that are coming down the pipeline that might be able to manage their problems.
Yeah, I've heard it said is if you're going to have a tough disease to fight through, it's good to have one where the whole medical community, the pharmaceutical community are focused on improving treatments.
It's part of the reason why I got into the breast cancer business is because our patients do so well relative to other cancers. So it's always a pleasure from my perspective to see those patients do well rather than the other way around. And it really is, fortunately, the vast minority of patients that don't do well.
Yeah. So we talked about finding it early, and as a surgeon, you would much rather operate on somebody when it's at an early stage.
Sure, for a multitude of reasons. One of the nuances of breast cancer surgery is that it's also a cosmetic field. And so it really does impact patients from a psychosocial standpoint into what that cosmetic outcome looks like after a surgery, so it's not disfiguring. And so when we can get breast cancers when they're smaller, I have to take out less tissue, and so it's less invasive for the patient. So even for that reason alone, it's beneficial to find things early.
Lumpectomy versus full mastectomy, has that changed at all in terms of how often you do one versus the other?
Oddly enough, over the years, I find that we've done probably more mastectomies over time. That percentage keeps increasing. I think part of that is patients are coming at it from a perspective of both treating themselves up here as well as down here, not having that psychological impact of having to worry about a potential recurrence or a new cancer down the road, even though from just a straightforward standpoint of is it more likely to happen or not, more than likely they'll never have a problem ever again, but at least this way they reduce their anxiety and it reduces their risk of breast cancer as low as possible.
Back to the mammograms.
Yeah.
Scares people for a couple of reasons. One, there's radiation involved. Two, you get some false positives, which psychologically is a really tough thing.
Yep. I think if you traveled across the United States in an airplane, it's probably the same radiation exposure as a mammogram. So it's very low as far as that is concerned. And I think with most people, denial is a very powerful thing, and people want to avoid identifying things. But when patients come in after a cancer has been identified, I always tell them this is a good thing. This is the only reason why you've been getting mammograms all of these years, is to find something. Now that we've found something, we can take care of it. You can move on with the rest of your life.
So I imagine the technology has gotten better. It's less radiation, but there are other ways of doing a scan.
Yeah.
How often is an MRI? I don't know what else.
So specifically with mammography, one of the reasons that detection has become so much better over the years is we've gone from analog films to digital films, and then we went from 2D mammography to 3D mammography with tomosynthesis. And other things that play a role in the whole cadre of imaging that we can do, ultrasounds, MRI. MRIs are usually reserved for very specific patients because they are so sensitive. I think they probably have more of a false positive rate than even the mammograms do. So you have to be very careful in who gets them and who doesn't.
Remind our viewers, if you have a question about breast cancer in general, you can send us an email, livequestions@mpt.org. I read that self-exams, they used to talk about self-exams all the time, and it's kind of been sidelined.
I mean, as an official recommendation, it's no longer recommended by the cancer societies. However, I still recommend my patients do it because there are going to be a large percentage of women who identify their cancers by self-palpation, who might not visit a doctor regularly, who might not go for screening mammography. So they're always going to be the first person who's going to identify anything in that situation. And so I always tell people to be familiar with what their breasts feel like, what's normal to them, what's abnormal to them, not really get bogged down in the minutiae of every little nook and cranny, but know generally what they feel like, what they should feel like, and what they shouldn't feel like.
Is breast cancer treatment ever surgery by itself, or is there always some radiation or medication involved?
There's certain, so non-invasive breast cancers or stage 0 breast cancers are frequently treated with surgery alone. As patients get older, there's less of a benefit to doing radiation or potentially hormonal therapy, which can have some negative consequences with bone density and things like that. And the side effects aren't always good for the patients as far as quality of life. There are frequently older patients where we just do surgery alone.
Everybody's heard of stages 1 through 4
Yep.
in various cancers. What's stage 0?
So stage 0 is a non-invasive breast cancer. When it comes from the milk ducts, it's called ductal carcinoma in situ, or DCIS, people have heard of. It means that it's just confined to within the milk ducts and it doesn't have access to the rest of the body. So the way that I explain it is there are all sorts of types of skin cancers. There are melanomas that can spread and they can kill you. There are basal cells and squamous cells that you just cut out and that solves the problem. So DCIS is more similar to that in that it's a breast problem. It's not a whole body problem. You have to remove it, and that's the majority of the treatment there.
Yeah, we mentioned at the top that the overall incidence has gone up.
Yeah.
Any theories on why and who is most at risk? And the other thing to touch on is the increased incidence among younger women.
Probably has with everything, our whole population is getting larger. So obesity probably plays a role in it. A sedentary lifestyle probably plays a role in it. Unfortunately, with most breast cancer questions, when it comes to why, the answer is a very unsatisfactory, I don't know. 95% of breast cancers, you can never really identify a specific cause. And as things trend towards younger patients, almost certainly the answer is going to be the very unsatisfactory. It's environmental. It's all the things that we come in contact in life. It's the foods we eat, the things we drink, all those sorts of things.
So if somebody wants to reduce their risk, what do? You try to eat healthier. But that's not all that satisfying either.
Correct. And with breast cancer, there's probably a 30-70 split between modifiable risk factors and non-modifiable risk factors. So modifiable risk factors are things that you can do to change the outcome. Non-modifiable risk factors are things like you're a woman, you're getting older. Those are things that put you at a higher risk for getting breast cancer, but you can't particularly change those. The modifiable risk factors are BMI or body mass index, whether or not you're healthy and active, alcohol intake. It's one of those odd things where if you drink too much, you put yourself at a higher risk. If you drink too little, you put yourself at a higher risk. So like Benjamin Franklin would probably advocate everything in moderation.
African American women, black women, are less likely to get it.
Yes.
But what I've read is that if they do get it, they're more likely to get an aggressive case, what would your recommendations be for members of the Black community?
Same recommendations as from any other racial community is get screening mammograms. And I think part of the problem with the stages at which things are diagnosed is with African American women, often they're found a little bit later, potentially due to access to mammography, distrust of the medical community. All of those things play a role. But I think if you look stage to stage with particularly early breast cancers, the mortality rates are about the same. So it really has to do with early detection and finding things when it hasn't gone to the lymph nodes and when it hasn't gone beyond.
Viewer question, if you've had a mastectomy but the implant is not smooth or rippling, is that something to be concerned about? In other words, could that be more than cosmetic?
So there are two things related to implants, and I'll try to figure out what the specific questions are. So there are textured implants and there are smooth implants. Textured implants have an association, a small association with a type of lymphoma. So someone might have heard something about that. If someone's not having any issues with their implant, that's not a particular reason to have them removed or to be concerned with it. If it's just an issue of rippling, that's just a component of the implant itself and the amount of skin and fat over the top of it. So you might see ripples in an implant.
I just want to note quickly, with a short time left, that this is an email from someone who had a lumpectomy 4 weeks ago at St. Joe's, very grateful for the care and encourages women to get their mammograms and take advantage of free mammogram programs, and you would second that?
I would definitely second that. Yeah.
What's the most important thing you want women to take away from?
Breast cancer is not a death sentence under the vast majority of circumstances, and I always tell my patients every single day that they're going to do great. And so it really is important to get mammograms to find things when they're at an early stage to guarantee that they've done everything to be successful with that.
Dr. Ethan Rogers, we appreciate your time.
My
Thank
pleasure.
you very much.